In health news, the risk of developing cancer can be reduced by taking GLP-1 drugs, according to more than 24 separate research studies that were presented at the recent American Society of Clinical Oncology meeting. Now, these are not the first studies to report this finding, but they are the newest and most convincing evidence that these medications designed to treat diabetes and obesity go far beyond just that. Our medical expert, Dr. David Winter from Baylor Scott & White, is here with more on what is considered to be an exciting extra benefit. So, good to see you again.
Good to be with you, Kara.
Now, the weight loss diabetic drugs, they somehow can prevent cancer. I mean, a lot of people are going, it sounds too good to be true.
Yeah, well, they do. Now, let me tell you what we're talking about to be clear. Ozempic, that's a GLP-1 drug. Wegovy, I've got here Rybelsus, Zepbound, also Mounjaro. All of these drugs actually can help with cancer. Earlier studies had shown that indeed you're less likely to get it. New studies came out last week saying, well, if you have cancer and you're under treatment for it, and taking one of these drugs, you have better outcomes. You live longer. You have less chance of metastasizing. Your cancer is spreading through the body. So they do a lot of great stuff, and we're finding more and more good stuff lately, Kara.
What is it exactly that they're doing to help researchers be able to find this evidence?
That's a very important question, and the answer is not totally clear. A lot of discussion about that. One thing we know, if you have chronic inflammation in your body, you're more likely to get a cancer, and these drugs can help calm that down. They also can help with insulin resistance, which is a factor with cancer. They may even help with the biology of how tumors start. So a lot of work going on trying to figure out exactly the answer to your question. It's all good answers, though. We just don't know exactly what's going on.
Now, have they specified what types of cancers can be prevented or treated?
Yeah, there's a bunch of them, and I got my buddy here to help demonstrate cancer of the breast, of the lungs, of the liver, of the small intestines, large intestines, the kidney, for women, the uterus, and for men, the prostate. All of those have better results if they're on these drugs. And one study showed with these cancers, if you're on those drugs, you have a 1/3 less chance of dying. So incredible studies that have come out, most of these just last week.
So let's talk about any sort of anticipation that GLP-1 drugs can be used to treat a certain cancer. Like it's something that doctors go, okay, we want you to take this. Is that possible?
Yeah, a lot of studies are looking for that answer. You know, we're finding a lot of new stuff out all the time. These drugs, when they first came out, Kara, they said that they would help decrease the hunger hormone in your body and slow down your intestines. When you eat, you get full quicker, you stay full longer. Then we found out, by the way, less chance of heart attacks, strokes, kidney disease, maybe dementia. And now we're saying they work even better for cancer than we thought. A lot of research going on, and we'll have some answers. I think we'll see a lot more drugs in this category come out that will be specific for certain diseases. But all I can tell you is these drugs are great, and they look like they're finding better and better reasons to take them.
Unbelievable, but very exciting. I'm sure giving a lot of hope to people out there. Dr. Winter, thank you so very much.